Sheila Moore's story began 3 years ago.
My husband and I were in the car, and we got a phone call from my doctor. And I knew something was wrong when we got that, and he wanted us to come to his office immediately.
He just said that the pap smear came back with a positive test, and that there had been some Sonoma bodies, he called it, which was the starting of a cancer cell.
But to know if it had gone further or spread more, couldn't tell that until he operated.
My father and my aunts and my grandmother and, pretty much all the family members were all there.
I didn't know if it was serious. I mean, she's always had, like, skin cancer and stuff. And
I didn't even know what he was talking about.
The biggest thing that I remember was looking at my dad, and I remember he looked white.
Well, he told us that her cancer had metastasized and that it had spread to different organs, the diaphragm, parts of the colon, and the peritoneum in her stomach.
I felt like I was ready to have a nervous breakdown.
And they removed most of what they could, but there was a lot of these little sesame seed size cancer cells on all these other parts of her body. And that in order to get rid of those, that the chemo, follow-up was what would have to be done.
This was like on a Monday that I had surgery. I got out of the hospital on Saturday and started the chemo the next Wednesday.
Chemotherapy for Sheila's ovarian cancer made her violently ill. She became depressed and was unable to sleep. Distraught over her suffering, Frank requested a conference with Sheila's doctor.
And I said, well, what's the final prognosis here? I mean, what's going to happen? And then that's when he had explained to us that her situation, wasn't very good. That possibly she had, 3 years left to live, and that she would have to he wrote this down. He said she would have to make a will, get right with God, and to prepare a funeral. And with that, I mean, she was really upset. Emotionally, she just couldn't handle it. She couldn't handle making any kind of decisions at all. She couldn't even drive. Even after her surgery, she still couldn't function as far as thinking and trying to make important decisions like that. She just couldn't handle it.
100 miles south of Frank and Sheila, near Oregon's coast, Joyce Lane is coping with lung cancer. Joyce has difficulty speaking, so her story is told by her 3 daughters.
She called me one Friday evening and said she had some bad news, that they had discovered a large tumor, and that we were now on this course of dealing with the tumor. And that was how it all started.
She was so sick, so ill, that there was a lot of fear behind this diagnosis. We had a big family meeting, which my mother could not attend. They said, these are your options. You can do nothing. You can do this. You can do that. And my thought at the time was, how is she ever even going to get to treatment?
Surgery confirmed the disease was incurable. With Joyce's consent, her doctors pursued aggressive chemotherapy and radiation, which gave her 3 good months, but ultimately left her weak and addicted to morphine. Several months later, the tumor returned, and her oncologist advised nothing else could be done. Dissatisfied with that opinion, Joyce's daughters convinced her to see another physician.
Many patients come to me in tremendous distress. And it's not so much, I don't think, that they've just heard the word cancer, as it is the fact that they've just heard the word nothing can be done. The doctor that saw them and gave them a diagnosis of cancer said, I can't do anything for you. I don't think anything can be done. It's that destruction of hope that is so distressing to patients.
It was summertime, and I sort of had this vision of her going home to her home in Tillamook with her husband there, of just going home and saying, okay, that's it. My oldest sister, I think, really felt that treatment was not the best option. I wanted her to do it.
She'd said for years that she would never do chemotherapy, that she wanted to take the path of least resistance if she was very, very ill.
Now, when I first met her, her complaints included shortness of breath, change in her voice, which is due to cancer impinging on the nerves that control the vocal cord. general malaise, and I felt all those were directly attributable to her cancer. And if her tumor was sensitive to the drugs I have available, that there would be some hope for improving her quality of life for a period of time.
A decision was made to try chemotherapy's strongest and most expensive agent, Taxol.
The way I feel is that you fight for things. You don't give up. And it was more characteristic of my mother to give up on something that might require a struggle or a battle. And I was real proud of her for wanting to continue on.
The paradigm of Western medicine is the struggle between good and evil. And particularly in cancer care, it's the struggle between the evil, consumptive cancer cell and the previously normal, healthy individual. But it's seen as a struggle, not as a natural evolution of nature and as part of life. And I think many cultures see the approach of death as part of life and don't have that paradigm of struggle that we have.
Meanwhile, back in Portland, Sheila and Frank Moore have become disenchanted with her physician's advice and are uncertain about what to do next.
We went back to her original OBGYN that we have known for 10 years. He says, how have you dealt, asking me how have I dealt with this situation of her cancer, knowing that she's going to possibly, not be around in 5 years. And I was really taken back that he said that, because like I said, here's a guy we've known for quite a while, and maybe I was in denial at the time, I didn't know, but I was pretty upset with what he said, and I asked him the same question. I said, how would you feel if I told that to you about your wife?
I mean, you're hearing a doctor telling you that you're not going to live much longer. It's just kind of so overwhelming.
I explained to her that, yeah, we should look into changing doctors. If you're not happy with this doctor, it's not good for your health. And I said, you need to stay a lot more positive. And I had already made a phone call and talked to Dr. Casera, the oncologist up here, that I was referred to by a friend of mine. And that's when we moved over to the University Hospital.
But it was really frightening to change over to another doctor because it's a life and death situation.
We saw Sheila after she had completed 2 courses of chemotherapy about 2 months after her surgery to remove as much of the ovarian cancer as could be. In her favor, she's young. Most of the tumor was removed with the first surgery. And the tumor under the microscope is of a relatively favorable histology, a cell pattern type. So her survival might be better than 1 out of 4 chance of living 5 years. We usually use 5 years as our survival statistic. Most of the patients, though, with stage 3 and stage 4 disease will die in the first 18 to 20 months after their diagnosis.
When she was going through chemo, she was just depressed a lot, and I didn't want to see that. I didn't like it, and I just told her to. I remember telling her, open that door up to happiness.
I went to a support group with my mom and listened to some doctors give seminars on it, and I just became more familiar with it and how it got there and what they were doing to remove it or provide the chemotherapy treatments and what we were going to expect.
She started to really perk up. I mean, she really started to perk up and say, hey, I'm gonna try and beat this. I'm not gonna be just whipped down like she was before.
Sheila and Frank went to Dr. Casera's office to discuss the results of her blood workup. Every 3 months, he administers a blood test to monitor her antigen levels. She's disturbed to learn that her numbers are up slightly.
My blood test, did you see it? Mm-hmm. It's at 20.
Yeah, I think 20 is basically the same as what's always been. And
3 months ago, her test came in at 16. For her, even that small increase is cause for alarm.
Is the cap still 35?
Mm-hmm. The range is still 0 to 35.
Okay, 0 to
it's just the
35.
refinement of looking at the number. So we still consider it normal. It's just a little bit different number.
Well, this makes me feel better. I was thinking, my last time when it reoccurred, it was 12, and 3 months later it was 292. So I was thinking, is this on the rise, or,
Yeah.
I was thinking about asking for another test.
I think patients expect a fair amount from modern medicine. Remember, it's still quite short on delivery. If you look at some of our statistics, particularly ovarian cancer, we haven't done that much better in the last 20 years.
Yeah, oh, I have a question for you. So you think I can beat this?
The fact that you're out more than 2 years now
Yeah.
means you probably have a lot better chance than the average patient, because the average survival for stage 3 ovarian cancer is 18, 20 months.
Oh, is it?
You know, we've always said it's an oxymoron, but you're healthy with this cancer.
Right, right.
So you're
That's
already
true.
an unusual.
Yeah. Well, thanks. I love to hear this.
I
I should tape you.
In this group of people.
Go ahead. Keep telling me. Okay.
So anytime you're out 2 years, then it's pretty positive. I mean, it's pretty good. Good sign.
Well, the further you get out,
From here now.
and
Yeah.
the longer you remain symptom-free,
Right.
the better you are. But if you look at survival, the clock starts at the day of the first surgery, and for some it ticks out after 60 months, and some after 6 months.
But what about after 5 years, if a person makes it that far?
You still may die from the disease in the 6th or 7th year.
Yeah.
That still happens.
Yeah.
And I've told you, we have a patient that now 7 years ago, I told her, as I told you, that this is a bad disease and the survival at 5 years is 20%.
Right.
And every year on the anniversary of her surgery, she calls.
She calls.
She called last week.
Really?
She calls and says, I'm still alive, I'm doing well, thank you. I'm having a party, and I'm celebrating, and we encourage her.
Tell her to call me.
Yeah.
We can celebrate together. No.
He said people with your stage of cancer, in the a lot of them, the percentage of them, 18 to 30 months are not around,
Yeah, I was surprised at that.
and you've passed that stage.
Right.
So that's really positive. He really, it really seemed pretty good, and you've responded to all the different drugs. What about that one lady that was his
Right.
patient that was how far out since 1988?
Yeah. I don't recall him ever saying that absolutely, or giving me that much positive on survival, that there is the possibility that I could beat this. Of course, I know that nobody knows, but
I take it a lot of the people that have had this type of cancer don't respond as well as you have.
no, that's why it's so, that's why it's so bad, because they don't, I think it's as bad as lung cancer, that's pretty heavy duty. I just thought he said a lot of good things that, made me feel better about my whole situation. My first hope when all this happened was that I would live until Ashley, which is the youngest one, graduated from high school. And that's what I hope. If I don't beat it completely, that would be my hope, to live that long. I look at my 23-year-old and that has to call me every day or come see me, and I look at my 9-year-old and think, this is not fair, I mean, you know what I'm saying? I mean, they're just, at that point, I mean, what would it be like if I wasn't there when she's 23, And so I felt like that, yeah, that's my reason for living, yeah, basically.
3 months later, Sheila's blood test measured 407. Her cancer had returned. She is currently on chemotherapy. Terminal illness raises difficult questions for doctors and patients alike. How do we balance treatment and cure? How do we decide when enough is enough? And how much care can we really afford?
When cure is a possibility, cost is pretty irrelevant to what I think about. With a patient like Mrs. Lane, where cure is not in the cards, cost is also very important. There's just no way to say what the trial is worth, what the chance of a meaningful response and improvement in quality of life for a while and possibility of prolonged survival. There's no way to say what that's worth. And of course, it's worth different amounts, I think, depending on who you are in the equation. Are you the patient? Are you the daughter? Are you the insurance company executive? Who are you in all this?
Money is a scarce resource. getting people to accept that is the first hurdle.
As insurance companies and HMOs focus more and more on cost-benefit analysis, they will likely limit the amount of treatment for terminally ill patients. Dr. John Santa is medical director of Oregon's Blue Cross Blue Shield and sees a future of hard choices.
Should we bring on a technology or a treatment program that could prolong the life of a terminally ill cancer patient by 2 or 3 months? Or should we bring on a technology that will decrease the number of low birth weight babies and premature babies? And they won't have the money to do both. They will not have the money to do both. And they will choose the technology that will help low birth weight babies. And that's not wrong. They're not saying, you know, we don't want to help cancer patients. They just can't do both. The days, I think, of a conscientious healthcare person saying, I don't have to worry about all of these other issues, I don't think that person's being responsible.
But I think on a personal level, when it's your family member who's being forced to make these decisions, the idea of using financial parameters for the decision is just too painful. And of course, that's the dilemma for our society, is that that is absolutely true on a personal level. It's true for every one of us, and it'll always be true.
Meanwhile, Joyce Lane has begun her Taxol chemotherapy.
The first treatment, she seemed to just sail through, and we were all made sort of a party out of it with her. You know, all 3 daughters were in town, and we had our children around, and she seemed like a fairly positive event, and she went home and got very, very sick. It was clear that it was very toxic to her system. It was also very clear that after one treatment, the tumor reacted like it was supposed to, in fact, very, very well.
Her energy level was better, her pain was less. There were times that she clearly had improvement in her symptoms. But she suffered many of the consequences of chemotherapy. The depressed blood counts and the need for transfusions, the hair loss, and she required hospitalization because of dehydration from nausea and vomiting. So she had some very severe consequences which alternated with periods of improved well-being.
We sort of felt like we felt like she was suffering, and we wanted more reaction from his office, his nurses, and they were responsive, but at the same time we knew she was getting worse and worse and worse, and they were kind of encouraging us to everybody to hang in there and, you know, get through this last treatment. It was finally her home health nurse who said she's in too much pain. We've got to get her somewhere.
A CAT scan revealed the tumor had returned, and the family had a final meeting with Dr. Dana.
I think that I think she was relieved to hear me say that I didn't think further chemotherapy would help. I think there was some resignation, but a lot of relief that that she wouldn't be pressured by me into further chemotherapy programs.
It wasn't worth it to keep trying. To me, before the decision was made to stop, it seemed to me that it wasn't worth it. It was just too hard on her. And it wasn't a good quality of life that she was living anymore.
In retrospect, I guess I'd have to say that it was such a brief remission with such a high price to be paid that it probably wasn't worth it.
Sick. Yeah. And who's this? Earl's sister. Oh, that's who you are. Sure, I remember your name. And okay, well, I think she's where she wants to be. She really hung in there until she could get home. And yeah, she's got all her kids and grandkids here, so yeah. Well, I mean, she's very, very sick, so Pam was trying to get to the alert times, but I'll tell her that you called, and she'll really appreciate it, and I'll sure tell her that, Kay. Kay, thanks for calling. Bye-bye.
We had always, almost always, if we could, met in August for her birthday. So we were gathered there to celebrate her 71st birthday. I kept a journal during that time, and I could see kind of how my thoughts went through the week. And I remember saying at one point, all I know is that at the end of this, my mother will die. That is how this time is going to end. And even knowing that, even knowing that it was so imminent, when it actually happened, it was still a shock.
When I found my mother dead in her bed, it was a very spiritual moment. It was no longer frightening. It was the middle of the night, which can be a very frightening time. But it was not something that hurt, other than within yourself. But by that point, been 5 days of suffering, you're begging for it. And so I think with terminal illness, I have a feeling that if I were to do it again with anybody else, it would be different.
We focused on two cancers that are very, very difficult to treat. Of course, not all cancers are that way, but clearly what we've seen